Drive with Kylie Baxter, 936 ABC Hobart.
Yes, it was only this week the Senate passed the controversial NDIS reform. Dozens of amendments were passed, which means from the beginning of 2028, every single person on the scheme will be reassessed. Quite stressful for a lot of people. So the goal is moving thousands of people to rely on yet to be established foundational support like Thriving Kids. So I don't know if you've heard about the program. I'd be curious to know. You can text me 0438 922 936. But people will need to start accessing this new support system from October. Children, as I said, aged 8 and under with developmental delays and autism will be the ones accessing the program, or their parents at least and carers. Dr. David Roy is a lecturer in education at the University of Newcastle and joins us now on the program. Hi, David.
Hi, it's lovely to be here speaking to probably one of the most beautiful areas of Australia.
Yes, Tasmania definitely is. I couldn't agree more. So tell us, David, exactly what is Thriving Kids?
Well, that's a really good question. What it is promised to be is services for children where they will be provided within the community, where they exist in schools and healthcare centres, and it'll be run by allied health. Basically, the way things used to happen before NDIS, where your Medicare covers it, that you will see physiotherapists and occupational therapists and speech therapists and etc. Within the community, and they'll interact together, and it won't be coming out of an NDIS fund and you have to get permission to go. It will be provided by the healthcare system, which sounds great, because when kids are more involved in the community and actually engaged going to there, and the services that are coming to them where they're at, it can seem like a sense of belonging in a safer space. That's what it can seem like. I'm sure you have questions.
I have a lot of questions because you sound a little dubious about whether it's actually going to be ready. So is the whole concept of Thriving Kids in comparison, say, to what's on offer at the NDIS? I mean, is Tasmania actually going to be ready to offer these services?
Oh, well, I don't know if anywhere is going to be ready, and Queensland hasn't even signed up for it. The real problem we've got is NDIS came along, all this money saying, oh, this is for supporting people with a disability, and for every dollar spent in NDIS, we knew that actually it was developing the federal economy by $2, so it's a brilliant investment. So all the services went to NDIS, and basically Allied Health kind of shut down and didn't provide services anymore, and many of the people who worked within Allied Health realised that working for companies who were signed up to the NDIS paid them better. So we already had a significant lacking in OTs and physiotherapists, and if anyone tries to get a psychiatrist or psychologist, they are a very lucky person. So they're moving it back to a system that will be government funded, and we know that government funds tend to be less than private, so will everyone want to move back to that? So that's one of the questions. Can we staff it? Secondly, have they actually got the infrastructure ready? Because it's a great idea. I actually do think it's a very good idea. I was very dubious at first, having family with disabilities and being very involved in the inclusion sector for multiple years in Royal Commission. But whether or not the actual infrastructure is going to happen and the administration, because we understand those families in NDIS, that in itself has been a nightmare. So we'll get to see if that's going to happen. And there's another little problem.
Oh, and what is this little problem? Because it sounds to me, Dr. David Roy, that you think there's going to be quite a lot of problems as far as the readiness of this program to do what it needs to do.
I would never want to suggest that government administration is a nightmare. However, one of the areas that they're also cutting is in the social participation funding across the NDIS. Now, that's when you might have a support worker that then allows someone with a disability to go to the shops or to go to the cinema or just to involve in the community. And people were going, well, why are they getting money to allow them to do normal day things? Well, that's because they need someone to support. Someone with a disability needs someone to be there for them to access the barriers and overcome them that society has in place. And they're cutting that. At the same time, they're telling families, we're now going to get you going into the community more with your kids. but we're going to cut the funding of how you get there. So the big concern for people is that they're going to provide all these services in the community, but they're going to rip out from under people's feet the ability to access those services. So that still has to be clarified. And I think that's where the greatest fear that I'm hearing within the community, not just kids under 8, but all the way to 108 are concerned about.
Do you think, honestly, Dr. David Roy, in your role as lecturer in education at the University of Newcastle and all of the expertise you have in dealing with the NDIS, you said you were involved with the Royal Commission, do you think that a lot of people with disability, with developmental delay, with autism and a range of other situations, are they going to be worse off under particularly the Thriving Kids program?
I think it's going to... that's a hard one. I think initially there's going to be a lot of hiccups. I think depending on the region and the state or the territory, that might pick up and get better depending on how mobile the people involved actually try to work and make it work for people, because the people involved really actually care about other people. I think it's going to be great for those children, particularly those under the age of 6 who potentially might have autism, but because they're under 6 will not necessarily be diagnosed of that and diagnosed with a developmental delay. The NDIS doesn't always fund that really well, and so Allied Health was much better at supporting really young children with suspected or imputated disabilities. So for them, that might be great. But yeah, I think there's going to be some children and some families that do fall through the cracks. And what I really hope is that the ministers, Amanda Rushton and Mark Butler, put something in place to catch those people. But they don't seem to be wanting to respond to that at the moment. They're quite defensive. And I also do think that maybe we're making the cuts for the NDIS, which needs to be sustainable, in some of the wrong areas. We seem to be cutting supports for children rather than looking at providers who are costing too much.
And so then how should success be judged with this program? Because I think, there are a lot of people around the country, but also in Tasmania, quite worried about the delivery.
Well, I think the biggest success is on the kids. Our supports, our services, are kids getting the services that are A, relevant for them, and B, are those kids, using the term of the programme, are they actually thriving more than they did previously? And that means they need to be researching it and need to be speaking to families and being encouraging. And what they really need to do is put a lot of public information out there through childcare centres, through schools, through where children are. Put up stuff in shopping centres, let people know what is happening and how to make sure that they are on board and that they are going to be connected to someone who can give them supports. And if people have therapists, speak to their therapists and ask them what's going to happen. Because for some kids, they've developed a relationship with those therapists. And when you develop a relationship in an engaging way with a teacher or with a therapist, you actually get better results. We know that. So the communication has to happen, and we have to measure it and publicly publish those results, not hide them away and kind of like publish them on, the 24th of December at 11:59 when no one's going to read it.
As often happens, we know how that works, or Friday afternoon when everybody's gone home at 5 o'clock.
Sorry if I sound cynical.
Okay, I've got one last question for you, Dr. David Roy.
David, go for it.
Do you think Tasmania, this state particularly, is ready for this? Are we ready to do the best we can, for people with disability, for children, and this very latest Thriving Kids program? Are we going to be ready in October?
I worry about that one because of the rural nature of so much of Tasmania, because of, we'll just say the challenges you've had because I'm not based in Tasmania, challenges you've had politically with different parties and making the state government really work functionally, rather than arguing about stadiums, about getting access to professional services. It's much easier for Sydney, much easier for Melbourne, much easier for Perth, and much easier for Brisbane. Whether it's going to be as easy for Hobart or for Launceston, I'm not 100% convinced, but it would be lovely if Tasmania could be the state that leads within disability support services. because that would be a great badge of honour to have on a country that is recognised internationally as leading in disability support. So I guess that's one for you as a journalist and a presenter to question your politicians.
Indeed, Dr. David Roy, and we do appreciate you sharing your perspective on the program. Thank you so much for coming on Drive.
Anytime.
Dr. David Roy there, lecturer in education, a lot of expertise in NDIS. He's from the University of Newcastle. The